About Senator George Lemieux's 2007 solution, and what would you recommend to reduce the national debt?
Well, the only way you can reduce the national debt is to reduce cost. You can't spend money that you have to go out and borrow and expect to get out of debt. Soon we'll be paying more in interest than, I mean, our national debt, this administration has spent what the previous administration, which we all thought was spending too much money, has spent. What it spent in 8 years, it spent in the first year and a half. We have to cut our cost, and as I said earlier, I started to say, and I'll use a little bit of time to get back to that, is I would start getting rid of federal bureaucracies that already exist at the state level. We must, and we don't have, people say you're not going to get elected saying you're going to fire federal employees. You don't have to fire. These things didn't happen overnight. They didn't just create all of these bureaucracies, even though they're proposing some very significant new ones. They didn't create them all in the last 2 years. This has been happening for a long time, and what you can do is you can, as these bureaucracies that already exist at the state level and are causing unfunded mandates, you can, as people retire or move or get away, you don't replace them. You take the positions out of the budget, and through attrition, you make the bureaucracies smaller, thus reducing the size of the debt and the budgets. Now, when the bureaucracies no longer can sustain themselves, you dissolve them, and you take the rest of the employees and put them into other programs, into other government jobs, and slowly those bureaucracies can be, we must reduce the size of government, and we have to do that by cutting federal programs. We don't need an education system at the federal level if we have a state education system. We don't need a health care department at the federal level if we have state health departments. So all of these things are ways that we can reduce our debt by reducing spending, the way we do it in business. That's how I would do it.
Ms. Harrington, 1 minute. How do you feel about Senator George Lemieux's 2007 solution, and what would you recommend to reduce the national debt?
Senator George Lemieux wrote an article back in February saying we could simply balance our budget and actually have a surplus if we went back to the spending levels of 2007. Sounds very simple. So all the government programs and growth that we have created between 2007 and now, we simply eliminate. And we could actually balance our budget. Senator Lemieux said, filling in for the then retired Senator Martinez, said he was appalled when he went to Washington to fill in. Because when they started to spend money, he said, well, don't you make sure you have the money first? Senator Lemieux goes, no, they told him that's not how it works here. Because in Florida, we're required to have a balanced budget. So I would propose a balanced budget amendment, and I support Senator Lemieux's idea to go back to the 2007 budgets. Thank you.
Same question, 1 minute, Mr. Lowry. How do you feel about Senator George Lemieux's 2007 solution, and what would you recommend to reduce the national debt?
I disagree with Senator Lemieux. I don't think we should go back to 2007. We need to go back to 1912 before the Federal Reserve was established. I believe we need to go back before the progressives started taking over our government. We need to go back to when America was free, when we depended on ourselves in our own hands to create our wealth and not a government entitlement program. I believe we can reduce our deficit immediately by over 8% the first day I take office. My new bill will be called the Lowry Reduction Program, and it's very simple. You take $1 trillion reduction of our national debt. Over $13 trillion, that's a little over 8%. How do you do it? You take the $500 billion of our TARP funds that our banks already paid back, that Obama's dishing out as a slush fund, and you pay down the deficit. You take the other $500 billion that they haven't spent yet from stimulus 1, 2, and 3, thank you Debbie Wasserman-Schultz, and you pay down the deficit. Now the world is going to be serious. They take note that the world will now know we're serious, and therefore we aren't going to inflate our way out of this deficit like they're scared to death. That's why China's not buying our debt. That's why we have to monetize our debt. What we need to do is reduce our deficit immediately, go back to 1912. I'd be much happier.
The next topic is health care. And the first question for 2 minutes goes to Mr. Lowry. Will you support the repeal or defunding of Obamacare health legislation? And how would you resolve the health care crisis? 2 minutes.
Wow. Health care, Obamacare needs to be repealed. But we have to address the problem. As we said earlier, Medicare is going to be bankrupt in about 6.5 years. The problem is simple. If this is every dollar we spend in health care, the government portions approximately 65 cents or 65% of it. This is the part that's broken. This is the part they didn't fix. What they did is brought the other 35%, you and me, into that system, so now we're all together in a bankruptcy. Never solved the problem. So what we need to do is find out what's actually wrong with Medicare. Why is it going bankrupt? Why are our costs actually spiraling? And what you have to do is, for the solution, is use free market principles. Quite frankly, let's reduce our costs by meaningful tort reform, which means you can't sue the doctor for just because you feel bad. You have to have a meaningful gripe against that physician, and you have to cap whatever part the attorney gets out of your suit. And that's what they did in my industry. It minimized all the frivolous lawsuits for healthcare, and it works. Texas did it. They reduced their costs by their healthcare insurance by over 20% for the individual, 50% for the doctors in their malpractice insurance. Brought more doctors into Texas, which gave you more competition, more choice, and more dollars in their pocket so they can hire that NP, that nurse practitioner, so you actually get better care. What a concept, free enterprise. Now what we need to do is also break down the barriers between states and let a lizard sell it at, say, 15% in 15 minutes. If we can buy our health care insurance like we buy our car insurance, we'll not only have more competition and reduce our costs and our prices, we all can afford to insure the 20 million that don't have insurance in the first place, which, by the way, that's their right as an American. The government doesn't have the right to tell me what I can or cannot buy. It works just like everything else in our economy. If you leave it up to free market principles, it works. When the government tries to get involved, it's inefficient, ineffective, and that's why we have the fraud. If you want to reduce the fraud, privatize it.
Same question, 1 minute, Ms. Milo. Will you support or repeal the defunding of Obamacare health legislation, and how would you resolve the health care crisis?
Absolutely vote to repeal it. If we can't get the votes, then we vote to defund it. But we must stop Obamacare. It's socializing our country. It's another step closer. So we have to start with that premise. Everything they do is to take away your freedoms and take away your wealth. Not transfer it. Many people try to get you to believe that it's wealth redistribution, it's wealth transfer. Take it away from all of us and put it in the ruling elite. Now, what I would do to solve health care is, I would say what Mr. Lowry, a lot of what he said is absolutely true. You have to privatize it. You have to reestablish your relationship with your physician. We have to have government out of our health care. We have to allow your relationship with your physician to be reestablished. So by privatizing healthcare, by meaningful tort reform, by allowing interstate commerce of insurance companies, by allowing healthcare credits that you can pay into when you're younger and healthy, there's many, many ways that we have to explore, and we must do that. We cannot allow the government to take over our economy and socialize it.
Ms. Harrington, will you support or repeal the defunding of Obamacare health legislation? How would you resolve the health care crisis? 1 minute.
1 minute for health care. It's amazing that we're even having this discussion when 63% of America didn't want it passed in the first place. And this is why I'm running for office, because people don't listen. I would absolutely support the repeal of health care, would do everything to defund it. If not, do enough amendments that would just about kill it. The Republicans went to the president, and they had great ideas. They say we're the party of no, but there's 3 simple things you do, which is no cost to the taxpayers: portability, tort reform, and allow the companies to compete across state lines. In my business, many people come in and go, Karen, we'd love to move to Florida, but I'm only 55. If they could take their insurance with them, it would help our economy grow. More people would move here sooner and take their insurance with us. So like I said, in 1 minute, that's hard to answer that question, but the bottom line is they are trying to take over 1/6 of our economy. They are not interested in our health care or making the 11% of the Americans who need it. They want to run this country and demoralize the insurance company and put the private sector out of business.
Goes to Ms. Donna Milo, the 2-minute portion. What is your position on cracking down on criminals who are bilking the funds from Medicare, Medicaid, and driving those programs toward bankruptcy? Ms. Milo. 2 minutes.
Certainly, I don't think I need 2 minutes for that one. Lock them up and throw away the key.